paper, we study how parental job loss affects child health insurance coverage. So this is in the context of the United States. In the United States, as in some other countries, employers provide health insurance to their workers and their families in many cases. And so this leads to health insurance being tied to having a job. And so when a worker loses his or her job, not only are they exposed to a loss of income and potentially other negative outcomes, but also the loss of health insurance coverage for them and potentially for their kids as well. So we want to understand, how does this impact families' health insurance coverage? To what extent are they able to recover private health insurance? And most importantly, how does a public health insurance program available to children mainly, but also to low-income parents, mitigate these impacts? So in the United States, there's a public health insurance program called Medicaid, and it's targeted toward low-income families. And so we want to understand, does the presence of this public health insurance option mitigate these impacts or not? And we look at this throughout the income distribution, looking at low-income, middle-income, and high-income families. And so we find very interesting results. When we look at private health insurance coverage, we find that all income groups have a lower likelihood of having private health insurance just after job loss. But the largest impacts are found in the middle income group. And this is because while low income workers are less likely to have private health insurance to start with, so they're less likely to lose it when they lose their job. And on the other hand, high income workers tend to recover private health insurance more quickly. It's really the middle income group, the one who's most exposed to the loss of private health insurance. And then we look at public health insurance, and we see that for children, to a large extent, the presence of a public health insurance option mitigates the impacts. And it works in mainly two ways. For low-income kids, they are more likely to be on public health insurance to start with, even before the job loss, and so they are less exposed to losing health insurance. For middle-income kids, they are much more likely to have employer-provided health insurance and to lose that coverage when their parents lose their job, but they also take up the public health insurance. And so even though they have some gaps in coverage in the short run, in the long run, this completely mitigates the effects. We also look at whether these short-term gaps have any impacts on healthcare utilization and expenditures by families, but we don't find any evidence of that. So it seems like Medicaid, this public health insurance option, is really helping families mitigate the impacts of job loss on health insurance coverage. We also look at whether more generous coverage in states that have more generous rules for how high the income can be to be eligible for Medicaid, does that help mitigate the impacts more or not? And we find that it does. So the higher the income limits that states have for eligibility in Medicaid, the lower these impacts on the middle income children. And so overall, this suggests that so first of all, we show that the fact that health insurance is tied to the labor market does create problems, does create short-term problems for families in terms of health insurance coverage. But we also find that Medicaid as a public health insurance option, even though it's targeted towards lower income families, it does help mitigate those impacts, especially for low income because they are less exposed to the problem to start with, but also for middle income kids. And the more generous the program, the smaller these impacts on having any health insurance gap.